Hello guys. So in this video we are going to discuss a very short but a very important topic from growth and development, which is the cephalocaudal gradient of growth. So this concept will attract a lot of MCQs, a little applied MCQs, and this is important in understanding certain treatment aspects regarding orthodontic treatment. So what does the cephalocaudal gradient of growth means? Cephalocaudal gradient of growth basically means there is an increase in the axis of growth from the head to the toe. To shorten it up, it means that the structures that are near your head grows first and faster compared to the structures that are away from your head. So they are giving you a basic example from the fetal life to adulthood, how the head and the limbs develop. So you can see in the first picture, it's a 2-month-old fetus. So the main component important in the fetal life, 50%, close to 50% of the body has been acquired by only the head. So the head is developing first and faster. So you can see the limbs are all rudimentary, nothing has been developed. So but the head is close to the maturational state. The next, at birth, the head is close to 25 to 30% of the body, entire body, and the rest only is the limbs. So the head has completely matured by the time of birth. Close to, it has reduced in size, but it is developing faster. So at the adulthood, close to 25 years, the head is only 12%. More than 50% is the upper and the lower limbs. So structures complete its development faster when they are closer to the head. So there is an increased axis of growth of structures from the head to toe. So basically the structures that are near your head will grow faster and first than the structures that are away from your head. So this is the basic concept of cephalocaudal gradient of growth. When they ask you in MCQs, they might ask you regarding the percentage. At birth, what is the percentage of occupied by the head? You have to write 25 to 30%. In the fetal life, the head occupies close to 50%, and at adulthood, it is 12%. So what is the implication of the cephalocaudal? Why do you need to know this? This is important for this. Because when a child develops, you can see the head and the skull bones are well developed compared to the jaw. So close to, you can see more of the same applies to your face, right? So when you're developing, the structures that are closer to your head develop faster, away from the head develop less faster or develop later. So head, your skull, your cranial base, your cranial skull bones develop faster compared to your jaws. When you take the jaws, maxilla is closer to your head. So maxilla develops first, followed by the mandible. So how is this important? So when a patient comes with a malocclusion, which is involving the maxilla, you need to treat them early. A growing patient with a skeletal malocclusion involving the maxilla, we can do some growth modification to alter the pattern into a favorable one. So when we need to intervene in the maxilla, we need to intervene earlier. Commonly, when there is an issue with the maxilla, the patient is treated from 8 to 10 years. So that is when the maxillary growth gets completed. The mandibular growth still grows till the pubertal growth spurt, till 13 years, 14 years. So any situations where the mandible is retrognathic or mandible is prognathic, we need to delay the treatment little until the mandibular growth is happening. So any malocclusion that involves a skeletal management that needs growth modification of the maxilla, you need to intervene early. So this pattern is important, like I said, is because of the cephalocaudal gradient of growth. So the takeaway from this class is any structure that is near your head grows faster and completes its growth earlier. So treatment of maxilla must be done first, followed by the treatment of mandible. Thank you.